Prime Minister Philip J. Pierre has urged a coordinated regional strategy to address the escalating crisis of crime and violence plaguing the Caribbean, likening it to the battle against the COVID-19 pandemic. Speaking at the Caribbean Public Health Agency CARFA Conference on Crime, Pierre emphasized the gravity of the situation and the need for an unwavering collective effort to overcome it. The Caribbean Public Health Agency is hosting its 68th Annual Health Research Conference, focusing on the urgent issue of violence as a public health crisis in the region. The Prime Minister, in the keynote address, called for an end to the blame game among political parties and urged a unified approach, citing the impact of crime on successive governments.
How can we deploy a whole-of-society approach in our countries and region? How can we marshal our individual and collective resources in our countries and region to ensure that we win? How can we learn from each other's successes, good practices, and mistakes? And I want to make a special appeal to politicians and political aspirants. It's time that we stop the idea of trying to gain political points with crime statistics. It is time we stop it. Everyone should stop it. The blame game is over. The blame game is over because the crime issue covers governments. Successive governments have the same problem. We have to try to get a solution, and the blame game and calling for resignation of ministers, that will not help. We've passed that stage.
Prime Minister Pierre advocated for a public health approach to tackling crime, involving early intervention, data-driven strategies, and a multidisciplinary effort spanning various sectors, including education, healthcare, and law enforcement.
Also means that we must rethink the role of our schools, as well as the content of the school curricula. To reduce or prevent violent behavior among school-aged children, our schools will have to become more than mere providers of academic-based education. Emphasis must also be placed on equipping students with the requisite emotional intelligence, including self-awareness, self-control, and social problem-solving to thrive in a school or community that is at risk of gang violence. Besides schools, our primary and secondary healthcare facilities have critical roles to play as increasingly victims of violence are treated. In some countries, hospital-based violence intervention programs that involve screening and intensive care management have been shown to be successful and cost-effective in reducing the reoccurrence of violent injury.
The country's leader is aware of the fear and health problems that crime can cause. Pierre proposes applying a preventative healthcare model in concert with law enforcement and sociological approaches.
Adopting a public health approach to public security will require huge investments in capacity building, both in terms of equipment and training of frontline personnel. Ideally, we all need a comprehensive assessment of the training needs for the adoption of a whole-of-government and whole-of-society approach to crime prevention and control. We need a corps of well-trained and resilient counselors and psychologists in our schools and communities who can handle the emotional stress of working with at-risk children and provide family therapy for young people at risk of gang involvement and exploitation.
The Prime Minister called for a collaborative regional effort to combat crime and violence in the Caribbean. He proposed creating a dedicated body that would report annually to CARICOM leaders.
I believe all Caribbean governments would benefit from a targeted and sustained action research agenda that provides real-time data on trends and dynamics of violent crime at various hotspots. It seems to me that to be effective, this data will need to be generated at the level of the individual who may be predisposed to criminality. Much of the evidence on strategies to prevent and reduce crime and violence focuses on children and adolescents. However, additional research interventions are needed to address crime and violence throughout the life of an individual. I believe one way we could do this is through the establishment of a collaborative or group for cooperation on the abatement of crime and violence in the Caribbean, which would include all agencies which mandates in this area, as well as professionals, and which would feed into annual meetings of CARICOM heads of government.
Pierre's call for action comes amid growing concerns over the escalating crime rates in the Caribbean region, which have had a detrimental impact on tourism, economic development, and the overall quality of life for residents.